Now, the second thesis here is that evidence thresholds are increasing. And if you think about where the costs are being spent, it's new technology that is really driving a lot of the spending. Now, there's always this thesis that technology can somehow reduce spending, and that does happen in some cases, but by and large, technology in the healthcare space is deployed as expensive new biotechnology therapies that extend life but don't necessarily reduce costs. And so the play here is really about evidence, and it's about how these products are evaluated over time. And there have been some very interesting companies that have gone into this space that have brought to the table new ways of looking at medical technology, new ways of evaluating it. The government is desperate to find better ways to evaluate medical technology, as are payers, because they see this driving costs. And so that is really an area of focus. It's an area of focus for our company. And in fact, if you look at the growth within Avalere, I would say about half the growth that we've had over the last couple of years has really been around quality systems. How do you take the measurement of quality and actually move that back into the healthcare system so that you will have a reasonable basis on which to evaluate providers? And the government is getting into this act as well. And in fact, one of the most interesting provisions of the reform law is about using quality metrics for managed care to move a new component of the payment system. So if you're operating a managed care system right now and you're serving Medicare patients, next year about 10% of your payments are actually going to be based on quality metrics. And if you think about an environment where your margins are usually less than 10%, your entire profitability is now going to be contingent on these quality metrics. So that then raises a question of, okay, well, what are they going to be evaluated on? And how do you do better on the test? How do you, kind of get the right score so that you can make sure that you are producing here? And when you look at the examples of the metrics, it's a lot about public health. It's a lot about breast cancer screening and colorectal cancer screening and glaucoma testing. And so these are great opportunities. Every managed care company in the country is going to be focused down on that. It's the testing and the screening and a lot of the kind of prevention aspects that, again, are going to be fueled by these trends. The last thesis I'd like to mention is cost management, and this is really kind of the most immediate and direct piece that a lot of companies, again, are focusing on. And you take it right now. We have these siloed payment systems. There's a lack of coordination and management. So again, you go to your doctor, and if your doctor is remiss in maybe not managing your cardiovascular problem, and you go to the hospital with an MI, your doctor's not responsible for that in any way. And it's really these discontinuities in terms of responsibility and the cost implications further down that are the focus of a lot of the effort right now. And one of my favorite examples is in the area of long-term post-acute care. And take an example of the typical Medicare beneficiary, an 86, 87-year-old woman who has a hip fracture, and she's discharged from the hospital. Where's she going to go? There are a number of different alternatives. She could go in, let's say she's not ready to go home. She could go into an inpatient rehabilitation facility. She could go into a long-term acute care hospital, or she could go into a skilled nursing facility. Now, each of these different post-acute care facilities costs the federal government a very different amount of money, and some are much more expensive than others. And when my aunt, who was in exactly this situation, was discharged from the hospital, the physician came to me and said, well, where do you want her to go? And I said, well, I'm not going to, I was responsible for her care. I said, I'm not going to make that decision. Where do you think she should go? And she said, well, the rehab facility is very close to her house, and it's very convenient to both of us, and so why don't we put her there? And I said, great. And then I went back and I looked at the cost implication for the federal government, and the fact is that, if you think about who manages that care transition, the answer is that nobody who's actually responsible for the cost is managing that care transition. Now, again, that might be easier for me as a consumer, but for you as a taxpayer, that's not a good deal. And if you think about that as an example of the kind of opportunity that sits within the system, companies that are capable of managing those kinds of care transitions are very interesting. And if it's not this year or next year, it's going to be the year after that the federal government comes to its senses and says, you know, we really need to do a better job of managing these kinds of transitions. So we're very focused on that. And that's, you know, again, I think kind of a nice example of the opportunity that sits within this market of change. So to wrap up, we are in a reform environment that is really creating a lot of uncertainty and a lot of churn. And that churn is good for some businesses, bad for others. And when you think about the different kinds of opportunities, there's a lot of analytic work that is required to think about, well, okay, we know that there's a coverage expansion, but does it help a particular company? That depends on where it's located. That depends on the geography. A lot of new businesses are going to be formed out of this period of uncertainty, just as they have in prior periods of uncertainty in healthcare. And this concept of medical cost management is really, I think, underlying everything. That if a company is positioned to reduce costs to the system in a time of fiscal crisis and in a time when there's really so much dislocation, it's going to be well positioned in the future. So with that, I will close and give the podium over to Laura to talk about the next sector. Thank you very much. Thanks.